One of the main things that I really stress to people is if you breastfeed, to do breastfeeding education before you even breastfeed. Like, do it while you're pregnant, because it's so hard to just wing it. Really, really do breastfeeding education, and then just education in general. And that's my whole thing, is education. So keep asking questions and keep, stay informed.
So today we're going to talk a little bit more about postpartum issues, kind of like next steps. So what are the typical bodily changes your body will go through postpartum?
Yeah, so there's a few. The first one, obviously, being that your uterus shrinks down. So, when you have a baby inside you, it's real expanded and big. And then once baby is born, it goes, back down. It's about the size of like a cantaloupe right after you give birth. And it has to contract and shrink down back to normal size during that postpartum period. It actually takes about 6 weeks for it to completely go back down to pre-pregnancy. So I believe pre-pregnancy, the size is about the size of your fist. So it has to go basically from this to like this, and that whole process takes about 6 weeks. The most dramatic shrinkage is going to happen in the first 3 weeks, and then that next 3 weeks it still takes a full 6 weeks. But so that's the first thing, is that your uterus just starts to shrink down. Bleeding obviously comes with that, regardless of if it's a C-section or a vaginal delivery. You have that placenta rip off, so there's a big scab in your uterus, and that's why you bleed so much. Mm-hmm. So bleeding, and some women experience that up to 6 weeks postpartum. Usually it's going to start with a real heavy period at first, and then kind of slowly taper off. I bled for 6 weeks. I would kind of go through spurts, like, it would be a heavy period for like the first week or so, and then it would kind of look like it was starting to fade, and then I would have like another episode of like heavier bleeding. But yeah, that whole 6 weeks, I remember going to my 6-week appointment and still bleeding like a little bit, and then it was, within that next week it was fine. I stopped finally. So bleeding is one, and then breast changes. Even if you're not breastfeeding, you probably will, unless you do a really, really good job of not letting your milk come in, your breasts still might change if you don't even breastfeed from day one. But obviously there's going to be a lot of breast changes with breastfeeding. Your boobs get really full and much bigger when you breastfeed. And then after you're finished breastfeeding, maybe like they get softer, and it's just sometimes your areola or your nipples kind of change, cracking nipples and stuff like that. So lots of breast changes going on, more so with breastfeeding, but regardless of breastfeeding, you can't have breast changes still. And then your hair actually is another one. So usually during pregnancy, you get like pregnant hair. That's actually due to an increase in progesterone. It lengthens the hair follicle growth cycle. And so when you deliver, you have hormonal changes, and that growth cycle regresses. So you lose actually all that hair that you got during pregnancy. Most people lose it at about 3 months postpartum, but it just kind of depends. Sometimes breastfeeding moms lose it later because you kind of use the same hormones during breastfeeding. You have like that progesterone during breastfeeding. So if you're exclusively breastfeeding, you might not have those hair changes for, months and months. I didn't exclusively breastfeed, but I was breastfeeding around the clock and not getting my period. And it was like right at 3 months. It was so weird that I had like clumps coming out in the shower. And that's like, it's normal. A lot of people experience that postpartum hair loss. So those are, few things.
So I know one of the main things you really wanted to talk about was how many women in postpartum go through all these changes, and different things might be happening to their body that they're kind of like, is this an issue? Should I go see my doctor for this? When in fact, it's actually very normal. So what are those occurrences that might happen that are completely normal?
Yeah, so there's a lot of them. I actually went through a lot of that stuff, even with the knowledge that I know as a labor and delivery nurse. When I went through that postpartum period, I had stuff happen to me, and I was like, what is going on right now? So one of them is some women feel really cold, and that can be not throughout that whole 6 weeks, but maybe in the first week, you kind of might feel like extra cold and extra chilly. So it might be due to the blood loss that you have during delivery. If you have like a postpartum hemorrhage or something, you obviously might feel colder, but still people who lose a normal amount of blood can still kind of feel cold. And it has to do with like the blood that's circulating through your veins is warm. So when you lose that, it changes your body temperature a little bit. I remember being bundled up in sweaters and like socks and slippers, and just feeling really chilly. And I didn't have a postpartum hemorrhage or anything. I mean, I had normal amount of blood loss. So feeling your heart race is also normal. That is something that you probably need to still bring up to your doctor, because that's also due to a loss in blood. So when you lose a little bit of blood, your heart beats a little bit faster to kind of compensate for that blood loss. Like you can kind of feel your heart pounding in your chest, and you might experience that more when you're changing positions or when you're going from like extreme temperatures, like you're stepping out of like a hot shower. You might feel that your heart starts to kind of race. And that is kind of somewhat normal. And that's another thing. It's not going to last 6 weeks. It's probably going to last a week, if that. It's just your body's, with that said, if you lose a whole lot more at delivery, these symptoms are probably going to last a little bit longer, because it takes your body a lot longer to regenerate that blood. And it is normal, but it is obviously anytime that you have heart changes, during pregnancy or postpartum, you want to tell your doctor, but they're probably going to say, yeah, that's probably normal. If you have like dizziness or feeling like you're going to pass out, obviously that's not good. We want to let a doctor know. But if you're just changing a position, you feel like your heart's racing more, that's a normal change. Also, so sweating is normal. You feel cold, and you also can sweat a whole lot more and pee a whole lot more. So when you're pregnant, you make a lot of extra blood and extra fluid. And then during postpartum, all that blood and fluid, some of it comes out during delivery, but it has to go somewhere. So you start, I remember just being in the middle of the night and waking up and just like sweating my butt off, like just be like covered in buckets of sweat, and you just pee a whole lot more. You're just trying to get that fluid out. And that's, like I said, maybe a week, maybe a couple weeks. A lot of people notice too that if you go and have a hospital birth, or you have like an epidural, or you have an induction, you're getting a whole lot of IV fluids, you might be a little bit more swollen. Like, swelling during pregnancy is somewhat normal in your feet and stuff, but you might experience a little bit more swelling after you give birth because of that. Like you get a lot more IV fluids during labor. And so that will contribute more to that sweating and peeing a whole lot more, because it's got to go somewhere. It can't just stay in. So a couple more things is the smell. So basically how, like, when your placenta detaches, it's basically like a big scab inside your uterus. So you lose all of that blood, and it's like been inside you for a long time, and it's just a whole lot. So it can smell a little bit funky. I don't want to say like, if you smell bad, like don't tell your doctor, because obviously that can be a sign of infection, that like foul smelling discharge or foul smelling urine and stuff. But yeah, just that blood, that old blood, it just smells different. You probably have a different sense of smell too, because you have hormonal changes. So it's probably going to smell different to you for that reason alone. But yeah, you just kind of smell different and smell a little bit stinkier down there, which is normal. It's totally normal. It's like just kind of like a stinky period. I don't know, that's the best way to describe it. Another one is constipation. So constipation is really normal right after you give birth, and that's why they give you a lot of stool softeners when you give birth. Also just due to hormonal changes, and just your body just had a really stressful event. And sometimes when you have a lot of stress in your body, you don't poop. So because everything just kind of stops. And you also, before labor even starts, a lot of people have diarrhea, or they just poop a whole lot right before labor. So you kind of clean your body out, and then you're constipated for a few days, and you have that first like postpartum poop that everybody probably terrifies you about, because that's awful. So constipation is a big one, and it sucks, but take your stool softeners, lots of water, warm water. So that's very normal. It's not fun, but it's normal. Rectal pain is another one. So If you get hormone or if you get hemorrhoids during pregnancy, then you're more likely to have them during postpartum as well because you just pushed a baby out. So that's one cause of like rectal pain is hemorrhoids. And then another one is just so as your uterus is kind of shifting, your organs are kind of moving around too, and you can just have, I experienced it, you just have these like sharp kind of butt pains. I don't know, that's the best way to describe it. You just like all of a sudden you're like, oh, and it's just your organs kind of moving around, and as that uterus is shrinking down. And if you have a C-section, you might experience gas bubbles. If you've ever had like abdominal surgery, it feels like you're having a heart attack. Like it's that bad of pain that you get from these gas bubbles. And I think you can even have them from a vaginal delivery, but they're definitely a lot more prevalent when you have a C-section because they're, they're cutting you open and manipulating stuff around. And then the last one is sometimes you might feel itchy down there if you had a vaginal delivery. So if you had a vaginal delivery and you had a tear and your provider stitched you up, sometimes those sutures can kind of, as they're healing, they kind of heal and get into that skin and they just cause some itchiness. And that's totally normal. If you ever have any discharge that comes with it that's like yeasty, then you would want to tell your doctor, but just general like itching down there is somewhat normal. So lots of weird stuff.
Oh, but that's totally helpful to know because I'm sure there's so many new moms that are like, you don't need to go to the doctor right now. So
yeah.
Cool. All right. So I have a fun one, but it has to do, this can be anything regarding, labor, pregnancy, any of your specialties. But if you could have a billboard made today where you could share one tip with moms everywhere, what would you say?
Can it just be like my whole Instagram feed? Just like everything that I recommend?
Yeah.
Like my Instagram profile? No. One of the main things that I really stress to people is if you breastfeed, to do breastfeeding education before you even breastfeed. Like do it while you're pregnant because it's so hard to just wing it. Really, really do breastfeeding education and then just education in general. And that's why I said my Instagram profile because that's like my whole thing is education. So keep asking questions and keep, stay informed. It would just say stay informed at the bottom.
Like that. Hashtag stay informed.
That's right.
Okay, awesome. And then can you remind everyone again where they can find you on your Instagram?
Yeah.
Because I'm like obsessed with your Instagram. So
a lot of people are. No. So my Instagram is at mommy.labornurse, and that's where I'm most active. I post pretty much every day and I'm on my stories and stuff. So,
well, thanks again. This was an awesome interview. I know I learned a lot. And I'm sure this will help out all the moms out there watching.
Thanks for having me. Bye.
All right. Bye.